last segment talking about it. Our team doctor over here on Off the Bench is Dr. Jeremy Burnham, and all of the specialists over at Ochsner Health and a part of Ochsner Sports Medicine. Dr. Burnham over there is an orthopedic surgeon, specializes in ACLs and knee surgeries, and we wanted to dial him up and ask him. He's a former student athlete. He's a former college football player as he played at LSU. He graduated from Parkview Baptist here in Baton Rouge. Went off and did his medical training at the University of Pittsburgh and was around that area, and now is back down here as working for Ochsner and their sports medicine department. Dr. Jeremy Burnham joining us here on Off the Bench this morning. Doc, always good to catch up with you. How are you? Good morning.
Hey, good morning. Hey, I'm good. How are you guys doing?
Doing all right. So you read Dellinger's article, and we talk about some of the ramifications that could happen with COVID-19, and one of them is a cardiac issue. As a trained doctor, when you read that, what is your reaction?
Yeah, the inflammation of the heart, or the myocarditis that he was talking about, we saw pretty early on in hospitalized COVID patients that was an issue. I think probably 25% of those patients that are hospitalized showed issues related to their heart, but we're just now kind of understanding what does that mean for people that maybe have COVID and are sick but weren't bad enough to be in the hospital. And of course, from a sports medicine standpoint, one of the things that we're always most concerned about is heart issues. It's one of the more rare things we see in sports, but obviously one of the more serious things. And so, I think he makes some good points. I think it's smart to be concerned about it. I don't think it's something brand new. I think it's kind of been on people's radar, and people have been screening and watching and testing for it for a while.
How big of a threat, in your opinion, is this for college football?
I think from a pure number standpoint, the risk is probably low if you look at the odds. I know that there's been a couple of players on the college scene that have had that, but if you are one of those people, it's a really big deal, obviously. And I think that the issue is that at some places, obviously at LSU, you're dealing with, they probably have the best medical screening and medical setup, almost in the country. And so I think that those athletes are already getting tested and watched closely for it. There are guidelines to checking and see if you have this issue after you've had COVID before you go back and return to play. There's also guidelines if you get identified with it about how to treat it. But I think it is a resource issue, as he kind of mentioned earlier, are all the colleges capable of doing this, and then what does it mean from a liability standpoint?
So as you mentioned, athletes are more at risk with heart things. If with this inflammation or some of the other problems that can arise, what is there a path to recovery? Is it permanent? What does that damage look like?
Yeah, I think we can't say for sure whether it's permanent, but we think that people probably recover from it. Myocarditis is something that can happen after lots of different viruses. It just seems to be maybe more common after this virus than some of the other viruses. And so in general, once somebody gets identified as having myocarditis, you're looking at a 3 to 6 month period before you're letting them get back to trying to do any real physical activity. So it's not like if you have myocarditis, you're going to be out for a couple of weeks and then, back playing that season. It's a pretty big deal. And obviously, you're talking about the health and the livelihood of an athlete, so you have to be really, really careful with it. I think, when you just look at pure numbers, there's going to be most patients that have COVID or most athletes that have COVID are not going to have myocarditis, but we're starting to see that certainly some people do. And I think the key is catching those people, not letting them go back to activity too soon, and making sure that all the screening processes are in place and that you're monitoring them when they do go back to doing physical activity again.
So one interesting thing, we're talking to Dr. Jeremy Burnham from Ochsner here on 104.5 ESPN. One interesting piece in the article, as you mentioned early on, it was thought only the most extreme cases, the hospitalizations, had this. But is it? Can you have? Could this happen to you even if you have been asymptomatic?
Yeah, absolutely. So if you're completely asymptomatic, the current guidelines, are not asking for most people that were completely asymptomatic to get this cardiac screening. But they are recommending that even if you have mild to moderate symptoms, which means you weren't in the hospital or anything like that, but maybe you had a headache or a little bit of a cough, that before you go back and start doing, high-level sports activity, that you get screened for this. And the screening involves blood tests, it involves an EKG, and plus or minus an echo, which, as was discussed, I mean, that's fairly expensive, but that's kind of a real-time look at the heart muscle. So I think that that's happening at the higher levels and at the higher level sports. Probably not available for every single person out there, but I think we need to be looking at it more closely and watching that. And so it is something to consider, and I think as time goes on, just like everything else with this virus, we're going to know more about it. We're going to know, what percentage of people actually have this versus those that don't.
Dr. Jeremy Burnham joining us here from Ochsner Health. As you can follow Dr. Jeremy Burnham on Twitter at Jeremy Burnham, MD. He's a board-certified orthopedic surgeon and team physician, and is the sports medicine director over at Ochsner Health. As you can follow them online at Ochsner Health. Doc, how many from the demographic of college-age students have you guys seen come in that have been affected by COVID?
I think you're seeing more and more. Whenever COVID kind of first hit this area, you were really seeing more of the people with really bad illness that were coming into the hospital, and in general, you were seeing a little bit of an older age group with that. I think as things have started to open back up, people are getting back into school. If you look at the numbers, there's definitely a higher percentage of young people. Most of the time, this is not requiring hospitalization, but certainly we're seeing that more. And part of it is that we have more testing per capita than any state in the country right now, and so we're just testing more people, which is a good thing because we're able to find these people that maybe didn't have symptoms or that had mild symptoms, and once they know that they have COVID, they're able to kind of stay away and isolate from spreading it to other people. But we're certainly seeing that age shift into a younger age group now.
Dr. Jeremy Burnham joining us here. Doc, I have mitral valve prolapse that I was diagnosed with when you and I were together in high school, and I had to sign a waiver. Like I still have to sign a waiver when I go to the dentist,
right?
Because of that. Is this something that could be possible from a medical standpoint as far as giving authorization to play?
Yeah, I think it's a unique situation in that there's a lot going on. There's the fact that a week ago they kind of came out and said that the players can't form a union or can't have this consent. And so the real question, I think, is, are we looking at it from an employee standpoint where the union can get together and they can come up and they can make a decision and consent to go to play, or are we looking at it in a different situation just purely from a student athlete where maybe the student athletes can't consent? And I think that's something to be considered. It's been interesting to watch just over the last 12 hours or so, all the people that have come out, the athletes on Twitter and the movement to play. And so I'll be interested to watch and see how much of an impact that has on the actual decision for the season.
So I guess from a medical perspective, let's say the players were unionized or were allowed to opt in, right? They're allowed to make that decision. Is enough known right now where the medical advice would feel okay with letting them make that choice?
Yeah, I think that's complex. I think if you have all of the screening and monitoring tests in place, I mean, just like with the spread of COVID, a lot's been talked about the fact that maybe the safest place for a student athlete is on campus or at the football ops building where they have all of this infrastructure in place to monitor for COVID symptoms, to test people. Same thing from a cardiac standpoint. They're going to be in a situation where they can get some of the best testing that's available. And so I think it's a decision to be had. It seems like maybe that horse is out of the barn a little bit, just certainly from reading the media over the last 24 hours. I think people are going to have a liability standpoint. And from a legal standpoint, there's a lot of complexity to whether, a waiver, if a student athlete signed a waiver, is that enough? But I think at bare minimum, you have to have the screening mechanisms in place. You have to have clear evidence-based return to play guidelines. And then whoever is going to play or proceed with the season, I mean, that's got to be consistent across the board. It's not something that you just want to haphazard let people go back and play sports after they've had COVID.
The OTB team doctor, Dr. Jeremy Burnham, who is the sports medicine director over at Ochsner Health, the BR region, as we've told you and remind you every day, there are 3 regions, of course, North Shore, in Covington, New Orleans, and here in Baton Rouge over at the Grove location. Check out Dr. Jeremy Burnham on Twitter at Jeremy Burnham, MD. Always thank you for the knowledge and the time, sir. We'll talk soon.
Hey, great talking to you. Thank you.
Thank you, Doc.